Hello, my name is Amani Maxalls, and today I'm going to be discussing what finance and budgeting in healthcare is, its significance, and how it has been influenced by the COVID-19 pandemic. The U.S. healthcare system operates in a free market economy, so it is financed through both public and private funds. Public health insurance, such as Medicaid, Medicare, CHIP, and military health insurance programs, are funded by federal tax revenue, payroll taxes, state and local tax revenue, and grants from the federal government, while private health insurance is funded by employers and individual consumers. Healthcare stakeholders control the cost of care by creating price-sharing plans, capitating payments, capping annual out-of-pocket costs, establishing risk-sharing agreements, and developing utilization controls. Within healthcare financing, healthcare stakeholders manage and control the cost, capital, and cash involved in operating a healthcare facility or health network. They also develop budgets that are either time-based, function-based, or flexibility-based. Successful budgeting in healthcare involves developing a vision, assessing the budgeting strategy, conducting a strengths, weaknesses, opportunities, and threats analysis, implementing the proposed financing strategy, and monitoring and evaluating the outcomes of the proposed strategy. Moreover, healthcare budgeting is conducted either by line item or performance to control the cost of care and ensure resources are allocated efficiently. Next, I will discuss why financing and budgeting in healthcare is important and how it has been affected by COVID-19. Finance and budgeting in healthcare is significant because it helps healthcare organizations allocate scarce medical resources and prepare for changes in the healthcare market. Furthermore, it allows healthcare organizations to accurately predict their revenue and expenditures so that they may strategically design their service delivery and payment models. Due to the COVID-19 pandemic, healthcare organizations have had to reassess their budget and financing strategies. They've also begun to transition from budgeting models based on an organization's past expenditures to performance-based budgeting that emphasizes allocating financial resources based on need and efficiency. This is because healthcare organizations were forced to cancel non-emergency services during the beginning of the pandemic and consequently lost a significant percentage of their revenue. These losses led many healthcare organizations to close, while others dealt with the financial strain of implementing COVID-19 response efforts. For example, healthcare organizations have had to take on additional costs associated with purchasing personal protective equipment and hiring more healthcare workers to care for the influx of COVID-19 patients. One significant policy that helped reduce the financial strain on healthcare organizations was the CARES Act. This policy supported vulnerable hospitals by increasing Medicare and Medicaid reimbursement rates for healthcare organizations. Additionally, this policy allocated billions of dollars to rural health centers and hospitals most affected by the pandemic to help support health systems in vulnerable communities. Now I will be discussing the issues healthcare stakeholders should keep in mind in regards to finance and budgeting in healthcare during the COVID-19 pandemic. Healthcare workers should be mindful of unforeseen forecasting of the healthcare market due to the COVID-19 pandemic, a lack of organizational revenue due to changes in reimbursement policies, the misalignment of organizational priorities within their finance and budgeting cycles, and regulatory barriers that impact the organization's finance and budgeting models. In conclusion, I will be outlining finance and budgeting related recommendations for healthcare professionals moving forward. Firstly, healthcare professionals should collaborate with healthcare stakeholders to assess the future needs of the market and allocate resources more efficiently. Second, they should conduct a strengths, weaknesses, opportunities, and threats analysis to identify the areas in which the organization could invest resources in to enhance the delivery of services and improve the quality of care. Third, they should align departmental goals with the organization's strategic plan to increase organizational productivity. Fourth, they should regularly conduct cost-benefit analysis and review the cost efficiency of healthcare programs and services. And fifth, they should increase transparency and accountability towards healthcare stakeholders regarding the organization's budget cycle. Thank you very much. This concludes my presentation.